So today we're going to discuss about Mrcp PACE's consultation station, and I'm going to talk a bit about how to break the bad news. So in the consultation station, you may come across different scenarios. There could be breaking bad news. There might be an angry patient. There might be a chronic disease explanation. So remember, for all these, just you have to follow the format and keep in mind this format so that you don't miss anything. So here is a scenario for this patient. So you are a registrar working in a busy hospital. Mrs. Anderson, a 58-year-old woman, has been diagnosed with advanced pancreatic cancer. She is accompanied by her daughter. Now your task is to break this distressing news to Mrs. Anderson and her daughter, providing information in a clear and compassionate manner. So here's how are you going to approach this case. So again, I have divided into different sections. So always keep these sections in mind so that you are systematic and you don't miss anything. So going to start by introduction. So going to greet Mrs. Anderson and her daughter with empathy, and you maintain a calm and compassionate demeanor. So something on the line, something like this: "Good afternoon, Mrs. Anderson," and if you know the daughter name, "Thank you for coming in today. I understand this is a difficult time, and I'm here to provide you with some important information about your recent test results." Don't forget the introduction. This is very, very important, and it will create a very good impression on the examiner once you start with the introduction. Then the second step is you have to establish a supportive environment. So ensure a comfortable setting, and you offer a seat, but in the examination, obviously the patient maybe already be sitting. So acknowledge the emotional difficulty of the situation. So you can say something like this: "Please have a seat." If they are seated, it's okay. You can skip this. I want you to know that I'm here to support both of you through this discussion. I understand that receiving news like this can be incredibly challenging. Now, this last sentence is some type of warning shot actually, and so that the patient, you're making a ground so the patient knows that something is not right and some news may be not good. Or you can rephrase it and you can say this, that the test results has come back and it's not that we expected, or I'm afraid the test results are not good. Anything whichever suits you. Important thing is you follow these steps. First is introduction, and second is to establish a supportive environment. Then you move on to your third step, and in the third step you want to assess the patient understanding. So we're going begin by asking Mrs. Anderson and her daughter what they already know about the situation to gauge their current level of understanding. So you can say that, "Before we proceed, could you share what you currently know about your recent test results?" Now, this helps me tailor our conversation to your specific needs. Okay. So remember these lines, practice these lines, so it will be very easy for you. And if you don't practice, believe me, it will be very difficult and you will be lost in this consultation station. Now we have two consultation station in the Mrcp PACES format, and you have full 10 minutes with the patient, and there are no you don't have any examiner intervention in these cases. Examiner will only observe. So try to do it nicely and be confident and try to answer all the patient queries. Obviously there will be a lot of queries from the patient. So third step is assessing the patient understanding, and then you immediately go and you break the bad news. So use clear and simple language to convey the diagnosis while gauging the emotional response. So allow moments of silence for processing. So something like this you can say: "I'm afraid the results of the test indicate that you have pancreatic cancer." Now remember this, when you're breaking the bad news, you have to give the diagnosis, I must say, like straightforward. Don't beat around. Don't say there is a malignancy. When it is cancer, you have to use the word cancer. Mrs. Anderson, I understand this is extremely distressing news, I'm here to provide as much information and support as you need. So it's going to break the bad news and then you give some reassurance also to the patient. So this is our fourth step. Then you're going to provide some informations. So you offer a brief explanation of pancreatic cancer, emphasizing that further tests will be conducted to determine the extent of the disease. So something like this, you can say pancreatic cancer is a serious condition and we will need to conduct additional tests to understand more about the extent of the disease. This will help us develop the most appropriate plan for your care. So here you're giving some information in a bit detail about the diagnosis. Then you're going to offer the emotional support. So express empathy and offer emotional support. Allow time for Mrs. Anderson and her daughter to absorb the information. So something on the line, I can imagine that this news is overwhelming and it's completely natural to have a range of emotions. Please take a moment and feel free to express any questions or concerns you may have. So here you're going to, after giving the emotional support, you will pause and give sufficient time for the patient or the daughter to express their concern, or if they have any question, they will ask any questions there. And then you will move on to answering questions. So address any immediate questions or concern from Mrs. Anderson and her daughter. Be honest about uncertainties and express a commitment to provide ongoing support. You can say something like this: I'm here to answer any questions you may have and I'll do my best to provide the information you need. We will navigate this journey together and I'm committed to supporting you every step of the way. Okay, then moving on, the eighth step will be involving the family. So if appropriate, involve the daughter in discussion, encourage open communication with the family. It might be, you can say like this, it might be helpful for both of you to discuss how you want to move forward together. Your daughter is here and her support can be invaluable throughout this process. Now, there is one more thing I should mention before that. Here the confidentiality also comes in this case. So if you see a patient and the daughter sitting there, then you have to take consent from the patient that is it okay for her to discuss everything in front of the daughter, or she want it to be discussed alone or something like this. So that one I missed in the first part, but it is important that if the patient and any other relative there, so you take consent from the patient before you proceeding after the introduction. Then you're going to present the plan. So outline the next step in terms of further diagnostic tests, consultation with specialist, and a comprehensive care plan. So you can say something like that. In the coming days, we will schedule further tests to better understand the specifics of the cancer. We will work closely with specialists to formulate a comprehensive care plan that address your unique needs. Okay, going to give some sort of plan to the patient that how we'll move forward. And then we're going to schedule the follow-up. So discuss the importance of ongoing communication, schedule a follow-up appointment, and provide contact information for additional support. So you can say something like this: we will continue to communicate regularly and I encourage you to reach out if you have any questions or concern. Let's schedule a follow-up appointment to discuss the results of the additional tests and to plan the next steps in your care. So in this MRCP cases consultation scenario, our approach is to prioritize the compassion, clear communication, and ongoing support when breaking the challenging news of an advanced pancreatic cancer diagnosis. So I have done it actually quite quickly because my focus was on getting you all these 10 steps, and so you don't miss it. In between, the patients will ask questions and then you have to answer the question, the step, and then you move to the another step. So hopefully it will help you. Kindly practice it as much as you can with the different scenarios, so it will be quite helpful for you. Thank you very much, and I'll see you in my next presentation.